Today we are talking about why waiting. People say, "Oh, we are waiting." Some couples will say, "We want to marry, we will not have children until 5 years, 10 years, so that we can enjoy ourselves." And I always say that you are a joker. You can't do that. You can't do that. Biology does not work like that, right? So I'm going to be telling you today why waiting can reduce your options, right? And I tell you, waiting is not a good idea. If you want to start a family, now is the time to start a family, right? Waiting is not a good idea, right? And like I said, it's the comfort that will cost you the most, right? People will say, let's just wait a bit longer, right? Some others will say, maybe next month." Some others will say, let's not rush anything." Good statements, but it's going to cost you. Just stick around and learn how it will cost you, right? Let me shoot a flare because I'm having the feeling that somebody somewhere is looking for this information. Let me send out a flare. Okay, flare cannot go now. All right. So, people will say, "Oh, let us wait a bit. Oh, we just married. Why are we rushing?" Right? Others will say, "Oh, maybe next month." Others will say, "Oh, let's not rush anything." Is that a good idea? Are you sure it's a good idea? Because this sentence is just, they sound safe. They sound like what makes sense, right? They sound like patience, and they sound reasonable. But in terms of fertility care, waiting is not neutral. Waiting does not mean that is negative or positive. No, it's not. It's not neutral. So it's something that is happening to you while you are waiting. Sometimes waiting quietly closes the door you didn't know existed. Right? Back door is being shut against you. The windows are being shut against you. All because you said you want to wait. I'm not saying you should not wait, but I'm telling you that can be a very bad idea, right? In many areas of health, people will say time heals. Of course, it's true. Time heals. Even when you have heartbreak, time heals. Correct. But in fertility, time does not heal. Time actually narrows your choices until you don't have any choice anymore. So while in other aspects of health, time heals, fertility time does not heal. Your choices are being excluded day by day. Doors are being shut against you day by day. Right? This thing we are discussing tonight is not to make you fear, right? I'm just trying to give you biological reality. Is that okay? And from the things we have discussed before, we know as at now that eggs age. Eggs get old too. Sperm quality changes, right? And even disease progress silently. So while you say you are waiting, your options are shrinking, often without symptoms. And that's the problem with fertility. As your options are being eroded, there is no sign in your body that you are no longer having any option. Right? So why waiting can cost you too much. Right? And this is the reason why fertility differs from every other aspect of medical problems. Why? Because fertility depends on a finite number of eggs. Remember what we said about eggs? That A woman is born with all the eggs she will ever have. Women don't produce eggs. All the egg they will ever ovulate in this world, they were born with it. You see that your baby girl that was born today, she carries all the eggs she will ever have. So she's not producing eggs as she grows. Rather, she's losing them in a geometric measure. Right? And I always say, usually it's 1 to 2 million, depends, right? Okay, let's say the baby girl is born with 1 million eggs. Then by the time they get to puberty, about 1/3 of that eggs are gone. You can see the quantum loss of number of eggs. Then by the time they get to about 30 years of age, maybe somewhere around 2,000 eggs remaining, and you keep on declining until menopause. But Mawumi is here. So I'm telling you that fertility depends on a finite number of eggs. The number are already determined. It's not going to increase, but it's rather going to be reducing. Right? Fertility depends on time-sensitive egg quality. Why? Because as you grow older, the egg quality diminishes. Right? Egg quality diminishes. So it is actually time sensitive. Why you are saying we'll get married now, we'll take like 5 years or 10 years to enjoy ourselves first. you are a joker. You are a joker. It does not work like that. I wish it does, but it doesn't. Fertility does not run like that. Right? Fertility depends also on progressive conditions. Yeah. Who knows is here. Good to see you, sir. You're welcome. Yeah. Fertility depends on hormonal rhythm that changes with age. As you grow older, your hormonal rhythm changes with age. Some of the what used to be regular while you were young in your 20s is no longer regular when you hit 35. It begins to change. And that is why you have some of the complaint and the things you run about when you get older, right? So these are the things that fertility depend on. Who knows? Thank you, sir. You're welcome. Good to see you. Good evening. Right? Unlike blood pressure or sugar level, right? Fertility does not reset. Your blood pressure can reset. Your sugar level can reset. But fertility does not reset. There is no tendency to say you want to reverse the hand of time when it comes to fertility. Like I always say, if you spend 1 hour here with me here, that 1 hour you will never be able to get it back. That is fertility for you. So if for women, for every cycle, the number of eggs that are lost will never be gotten back, and that is minus the finite number. Right? Your knee hurts. Oh yeah, sorry about that. Sorry, I'm sure you'll be fine. Is that okay? So fertility does not reset. You cannot catch up with fertility later. So you that is getting married and you want to use 10 years to enjoy your life going all around the world before you start having kids, you will never get that 10 years back. And that will be tantamount to whether or not you will face fertility challenge or not, because as you grow older, some of you are already a certain age before you get married, minus the 10 years you want to use to enjoy, you are losing, right? Then there are those who say they are not going to start any family. They want to pursue their career first. Let me ask you, how many hardworking, sincere people who pursue career actually hit the mark before 35 years? How many? Take the statistics. And yet, at 35 as a woman, both the quantity and quality of your eggs are diminishing. Yeah. So be smart. And I will say again, you want to start a family, today is the time. Start now. Fertility does not wait for you. Biology does not wait for you. It is you that will strategize around biology. Take advantage of the knowledge that you have. KC, I see you. Don't worry, I will get to your question, KC, but just listen. We're discussing fertility. Your knee will be fine. Mhm. Sorry about that. You see, this thing we call female biological clock, it is not a metaphor. And in fact, I know ladies who hate to hear that. Well, however much you decide to hate it, it is true. There is something called female biological clock, and it is not a metaphor, right? Women are born with all the eggs that we ever have, with all the eggs they will ever have. And over time, the egg number will decline steadily. Over time, the egg quality declines faster, right? Because of the number that goes every month. And over time, over what do you call it now? Chromosomal errors increase, and that's what determines the quality. These mommies that you'll be in trouble very soon. You'll be in trouble. All right. So because chromosome, the genetic material in the egg is actually what determines the quality of the egg, and it diminishes as you grow older, right? And one thing that we know, this information will serve you very well. If you're writing it down, please write it down. We already know that the chances of natural conception per cycle, right? I'm going to take it by let's take it by ages, from early 20s down to uh, early 40s. Let's look at the percentage of the success rate or chances of conception, right? Early 20s. Early 20s. And remember, egg quality is at the optimum in your 20s as a woman. That is why only females in their 20s are more likely to be accepted for donation, for egg donation. Why? Because that's where you can get the best quality eggs. But less likely you have those in the early 30s, because we are always pursuing quality, right? So in early 20s, the chances, however quality the egg is, the chances of conception at early 20s is 25 to 30%. I'm talking about females that have no problem. Regular cycle, they're ovulating, they're healthy. The chances that this cycle that they're having, regular unprotected sex, the chances that pregnancy will occur is 20 to 30%. That is for individual that has no problem. Now, when you get to early 30s, that chances drops to approximately 20%. Look at the number. Then late 30s, what is early 30s? Early 30s means anywhere from anywhere below 35. Then late 30s will be 35 and above, 35 to 40, right? So late 30s, the chances of conception per cycle is approximately 10 to 12%. You can see why people at that age struggle more to conceive than people that are younger. All right. Then by the time you get to early 40s, the chances of conception at early 40s is less than 5%. Less than 5. Is that not interesting? Right? Less than 5%. Less than 5%. Right? So these are the chances of conception per cycle. So waiting does not pause this decline I just mentioned. Waiting does not pause biology. Waiting will not pause your fertility chances, your conception chances. Waiting is just hurting your chances. So let's say you want to wait until you get to 30s. It means that you have lost 25 to 30% chance to less than approximately 20% chance. So you can now see that the struggle is real at that age. So waiting does not pause biology for you. Rather, it's hurting you. Alright, that's for female. Now, what about the male factor? Male fertility. Of course, male fertility also change with time. It's not just women, right? Even men, male fertility change with time, right? And unfortunately, this is less discussed, but it's real. It's less discussed, but it's real. With increasing age in men, sperm motility declines. What is sperm motility? The ability for sperm to move, and the tendency is to move forward. So that motility declines as men grow older. You see why we advise those of you that are almost at the same age bracket, but in your 35 and above, boost the sperm. Because what it will take for you to impregnate a woman at that age will be different from what it will take for a woman in her 20s. Right? With increasing age in men, DNA fragmentation increases. And what did I say before? DNA, genetic material, all that constitutes what makes sperm quality. And now sperm quality declines as age goes further. And that is why miscarriage risk is high as people grow older. You see 35 and above, you see miscarriage risk is high at those age brackets. Right? And the time to impregnate a woman lengthens as you grow older as a man, right? So male fertility does not disappear, but it becomes less efficient as you grow older. That is the male factor. Becomes less efficient. It does not disappear, but it's always there, but it just decline in efficiency. Right? Now, some fertility problem worsens silently. And I'm going to talk to you about them. If you are still here, make sure you're tapping on your screen. Make sure you're sharing the live. Excuse me. Make sure you're sharing the live, and make sure those you think you need the information, they come in and learn what will be beneficial to them. All right. Now, let's talk about the condition that progresses while you are waiting. If they already exist and you are waiting for whatever reason, these conditions will progress, right? Some of these fertility problems will worsen silently. They may not give you too many troubles, but silently, but progressively, they begin to worsen. For example, endometriosis. Endometriosis can actually progress without symptoms. Without symptoms, it progresses. It can reduce ovarian reserve. It can affect egg quality and tubal function. That is why this endometriosis is very notorious. Right? Fibroid and adenomyosis can grow quietly. And as they grow, what do? They alter the uterine environment. Remember, for implantation to take place, you need an optimum environment for implantation. Now, when fibroids stand in the way, what's going on? It can impair implantation, and that is a fertility concern. All right. Tuber diseases or tuber disease like scarring can worsen while you are waiting. Because some people, after they've waited, okay, I'm not going to conceive now. By the time they are ready, they just discover that they have tuber blockage. Begin to wonder, what happened? What did I do wrong? Well, some of those issues worsen over time. Scarring can cause adhesion and blockage, right? And some other things that I will discuss in other episodes. And also, inflammation can recur. Tubal inflammation can recur, right? Tubal inflammation can recur. So waiting will allow the disease to advance without you checking it. Of course, that you are waiting now. Why would you be checking anything? So quietly it creeps up on you. Yeah. Waiting allows disease to advance unchecked. So the question of let's wait and see what happens is off the table, because this approach of let's wait and see what happens can only work when age is on your side. And when is age on your side? When you are in your 20s, right? It can only work when there is no underlying pathological condition that exists, and when timing is already optimal. These are the times or conditions when your waiting can work. In many cases, couples are watching while biology is moving forward without them. Biology is not going to wait for you because you have a reason to wait. If you want to start a family today, now is the time. Start now. Start now. So you are there waiting, and biology is going straight ahead of you. It does not have break. That is one part of human system that does not have break. No reset button. It's gone and it's gone. And the worst of it all, and that's why we're talking about it today. The worst of it all is that it reduces fertility options. Right? How does waiting reduce treatment options? This is where the impact becomes concrete. Yeah? Now, earlier in the journey, your options, earlier in your fertility journey, the options may include lifestyle optimization, ovulation induction, timed intercourse, minimal intervention, right? In the early stages of course, of your life and your fertility journey. But now you are the one that suspended conception till when you are ready, and now your options are minimal. Your options are minimal. Later, what happens to you? Waiting may leave you with IVF as the only realistic option. IVF is not bad, but most of the people would not want to consider that as a solution. And we keep on telling them, with where you are now, that is the only option, right? Waiting may also leave you with the use of donor eggs or sperm. You keep on waiting. So God will do it. You keep on waiting and praying and believing. You keep on waiting. Years have come and gone, and even you are aging. In the end, you just discover that you don't even have the quality egg or quality sperm to even make the IVF work. So what do we do? We're now looking for donor sperm or donor eggs, which some people will still further delay before they take the option, right? And now that actually reduces success rate, and of course, higher emotional and financial costs that comes with it. That's why now is the time. Now is the time. Time doesn't just reduce fertility. Time changes the menu of choices. You don't have multiple choices to select from, right? And we know already, excuse me, we know already that IVF success rate declines significantly after 35 years. So even at the age of 40 plus that you are attempting the IVF, the success rate is down. What about egg freezing success? Egg freezing success depends heavily on age at which the freezing was done. So you're freezing your eggs at the time where the quality is already, or maybe from 35 years you want to freeze egg. That will not, that's not the quality egg you are freezing, right? So even freezing of eggs, you want to freeze it at a time when um, the quality is still optimal, right? Also know that miscarriage rates increase with both maternal and paternal ages. That's why you see older couples who have issue of fertility, miscarriage over time, right? They complain of miscarriage. You see that with older couples than younger couples. What about live birth? Live birth rates per cycle drop year by year. So waiting will convert your preventable complexities into unavoidable intervention. It's important you know and learn it now. All right? Right? So you still have time, it's true, until it's no longer true. So do not let anybody deceive you with that statement. But don't worry, you're still young, you still have time. It is true until it's no longer true. Age is not a switch where you can say, okay, I want to go and do other things. Let me stop my age here, and biology stops for me. Then I come back to no. Age is not. It does not work like that. It's not a switch. Rather, age is a slope that declines. So by the time fertility visibly declines, your options are already narrowed. So narrowed that the options you are left with are the options that you don't like. All right. So those are the issues. Because all these I just mentioned comes with emotional costs. There is emotional cost for waiting too long. There's emotional cost for waiting too long. Patients will often say, if only we knew earlier. What I'm telling you now, this is the earlier for you. All right? This is your earlier. And I've said, now, today is the time. Whatever you want to do, you want to start having kids today. You want to go for IVF today. You want to take any intervention today is the time. So that you will not end up with saying, if we knew earlier, we thought waiting was safer. We didn't realize option would change. I'm telling you now, options changes. Biology will not wait for you. And the unfortunate thing is that regret is heavier than early actions. So take your actions fast and quickly. Right? Now is the time. So, mommy's daughter, what are you going to be doing with the remaining eggs? I'm saying is here. You're welcome. All right. Unfortunately, that is why this discussion is important. Right? That's why this waiting does not equal giving you yourself peace. That's not what it is. It doesn't. Waiting often will increase anxiety, will increase self-blame. Of course, when you just discover that all the time you said you were waiting and you were in your 20s, now you are in late 30s, and you said you were waiting, and now I'm breaking it to you that your best options were in your 20s, self-blame will come. Why did I wait? And of course, relationship tension, as I've seen for many years now, and which I usually advise couples, please don't please don't have relationship problems because of fertility. I know it's hard, but have an understanding, right? Have an understanding. There are those with emotional exhaustion already. See, I know do again. Don't pack your bags yet. I'm telling you, don't pack your bags yet. So that is why we bring you the TTC League, where action, guided information would lead to reduced stress. That's why we bring you TTC League, right? So take advantage of the information we share with you. But I know that this information is good enough, but again, there are people who will still rest on it. So that's why we have the league. The league is like what our parents did to us those days. When a baby is refusing to feed, what do? They bend your head down, pour the akamu inside your mouth. You take it by force. All right. So our parents did that to us, right? So that's what's going to happen. All right. So so these are the dangers of waiting. This the disadvantage outweighs the advantage of waiting. Today is the time to start that family. Start having kids. Right? Start having kids.